Hello and welcome to my second video. Today I'm going to talk about hearing loss. This is part 1 on my series about getting to know your hearing better. So let's jump in. To begin with, I want to talk about the definition of hearing loss. Broadly speaking, you would have heard people say that if you can't hear as well as others, or maybe if you feel like you've gone out somewhere and you're struggling a bit to hear the conversation, that might be an indication that you have a hearing loss. The definition states that when a person is unable to hear as well as his peers, or if he has a score of more than 20 decibels on his hearing test, it is termed as hearing loss. Hearing loss can be from a very mild level to a very severe to profound level, where people may struggle to just hear the finer aspects of conversations, to even being unable to hear the loudest of sounds. Before we move on to the different types of hearing loss, I want to show you a little diagram and help you understand how the ear works and what are the parts of the ears. Now, don't worry, this is not going to be a biology lesson for you. It's just broadly going to help us look at the different parts in our ears because that is important in understanding the different types of hearing loss. So in this diagram, you can see on the very top that the ear is divided into 3 parts, okay? So we can see labels which say external ear, middle ear, and the inner ear or the internal ear. So the part labeled in turquoise called the external ear consists of the pinna that you can see, your auditory canal, okay, and the eardrum. The middle portion, which is highlighted in yellow, is the middle ear. Now this is a very important part in our ear because it not only contributes to increasing the volume of the sound when it goes through your ear, but also because it's connected to the very back of our nose. Okay, so you can see that at the bottom of the diagram there's a little tunnel. That's this one. This little tunnel is called the eustachian tube, and these little bones are called the ossicles, and that's your eardrum. Okay, and then moving on to the inner ear, that is this part, that's the spiral that you can see labeled in a pink color. That is your cochlea. That is the main sensory organ inside your ear, okay, and it houses lots of different cells called hair cells. Now these hair cells are the vital sensory organs in your ear which are responsible for picking up the different pitch and the loudness of the sound and sending it through this cochlear nerve to your brain. Okay, now the types of hearing loss depends on where the damage is along the anatomy of your ear. So on the next slide, I'll help you understand 3 different types of hearing loss, okay? The first one is a conductive hearing loss, which is mainly caused by damage either to the external ear or to the middle ear, okay, or both. The second type of loss is the sensory neural hearing loss, which generally happens when there is damage to your cochlea, that is your inner ear. And the third type of a hearing loss is a combination of both of these called mixed hearing loss, which can happen when there's damage across the external, middle, or the inner ear. So let's have a look at those. Over here you can see that I've briefly outlined the 3 names of the types of hearing loss, which is conductive, sensory neural, and mixed hearing loss. So like I said, conductive hearing loss is a problem when the sound fails to conduct from the outer ear to the inner ear. Okay, and in most parts this is a temporary hearing loss. I say temporary is because when the infection heals, like for example, say if you have wax and the wax completely blocks your ear canal, then the sound won't be able to travel through to the eardrum and then move forwards from there. But once the wax is removed, the sound can conduct quite normally. So that's why it's called a temporary hearing loss. And common examples of this would be, like I just said, maybe wax occlusion. Sometimes people can have fungal infections of the outer ear. So when all of these fungal infections heal, they don't leave any residual impact on your inner ear, which is why your hearing bounces back to normal. Sensory neural hearing loss is the second type of loss, and this is more permanent in nature because given the damage that it lies in the inner ear, there is one characteristic that is quite unique with respect to the inner ear. Different organs in the body, they heal themselves in a different manner. Say, for example, if you take your skin, if you're chopping something and you get a wound, skin heals itself, the wound heals, and new skin can cover the wound. But in our inner ear, if there is damage to the sensory hair cells, new ones don't take their place, so the damage they leave is in most parts permanent. Okay, and common causes of this may be a viral infection, maybe it's just age-related degeneration in your hearing, because as we age, there is generalized wear and tear in our body, and your ears no different. Mixed hearing loss, as the name suggests, by itself is a combination of issues in the outer, middle, or the inner ear. So it can be something like someone who's had repeated ear infections since childhood. Maybe it's somebody who's had a surgery done to the ear, So these type of losses can be of a mixed nature, which means that there can be some infection, some residual infection, or a change in the anatomy of the middle ear, and then there's a bit of degeneration in the inner ear as well. So together they contribute to a hearing loss, and it's called mixed hearing loss. So how do we manage this hearing loss? What is the type of management? Is it the same for all the different types of hearing loss? That's something that I'll be delving into in my next video. Okay, so stay tuned. However, before I leave, I'll just give you a gist of the management approaches. Not the approach as such, but mainly whom do we contact? What is the pathway? What is the next step for you? So if it is a conductive or a mixed loss, your first point of contact would be your GP. So because I am currently based in the UK, I will be talking mainly about how to approach the audiology department in the UK. Okay, I work within the NHS. You definitely do have the choice to go privately. So go see your private doctor, go see a hearing specialist on the high street. For that, you don't need to go through your GP. You can directly just walk in or make an appointment with that establishment. But if you want to see your local NHS audiology department and you feel like there's some fluid in your ear, you feel like there's some discharge, or you're having symptoms of pain, please do visit your GP first, who will do a visual examination of your ears and then make the necessary onward referral to your ear, nose and throat consultant. If you feel well in yourself, there's no pain or discomfort in your ear, but you're still struggling to hear a bit, you would still have to go to your GP first. And when they see that your ears are nice and healthy, they are clear of any signs of infection, they will refer you directly to us at the audiology department in your nearest NHS Foundation Trust. So that's all for this video, but I will see you again maybe next week for discussing the special considerations about when do you approach your doctor on a more urgent basis, and with a lot more information on the different types of hearing loss. So stay tuned. Bye-bye.